Sound check 1 2 3. Sound check 1 2 3.
Good morning, everyone, and welcome to the Board of Health meeting for July 28th, 2025. I'm your chair, Ward 2 City Councillor Cameron Kretsch, and joining us today are Member Sarah Cheekham, Councillor Alex Wilson, Member Don Danko, Councillor Tammy Huang, Councillor Mark Taddison, Member Chelsea Kirkby, and Councillor Hernandez joining us virtually. I'm going to call the meeting to order as we have quorum for today's meeting and move to the first item, which is the approval of today's agenda. Could I have somebody move and second to approve the agenda for today? Moved by Councillor Huang, seconded by Councillor Nan. Are there any amendments from board members to the agenda today? I'm not seeing any. I will say that I have a feeling there'll be some motions in the motions section today, or at least one motion. Just wanted to let everyone know that. Probably will be happening. Apart from that exciting announcement, all those in favor, just by show of hands. Thanks, that's everybody. Our agenda is approved. We can get on with it. Declarations of interest. Any declarations of interest for today's meeting? Not seeing anyone raising their hand. So I'll move on to the approval of our minutes from the previous meeting, which was July 7th. Move for a seconder to approve those, please. Moved by Councillor Huang and Councillor Taddison. Any discussion about the minutes from our last meeting? Not seeing any. All those in favor by show of hands. That is everybody. Thank you so much. That carries. And now we're on to delegations. And so today we have delegations from folks from McMaster University, and we have folks regarding the Hamilton 350 proposal. Those are two separate sections of delegations. We'll receive the delegations by subject matter. So the first group is Keith Invigna, Kyle Chung, Ayan, Ahmed, Kartik Seth, and Ali Joyd from Healthcare Hacks, McMaster University, respecting their 2025 Healthcare Hacks proposal aimed at improving healthcare accessibility. A couple things I'll say. Your comments should be related to the Board of Health. That's the important thing here, and the impacts of public health and what we can do. You can come on up to the podium here whenever you're ready. Delegations are 5 minutes in length. At the 4-minute mark, you're going to hear a little ding, and that will remind you that you have a minute left, and then you'll hear another ding at the 5-minute mark, and then I'll ask you to wrap up, and then we'll take questions. For your knowledge, the podium goes up and down. There's a little switch on the side, left-hand side where Sal is standing, and you can use it to higher it up and lower it down. And just wait to start speaking when you see the light come on the microphone, and then you're good to go. I'm here if you need any help.
Good morning, board members. Thank you for the opportunity to speak with you today. My name is Keithan.
And my name is Avik.
And we'll be representing Healthcare Hacks, a student-led initiative at McMaster University that brings in young innovators to tackle real-world healthcare challenges. But Healthcare Hacks is more than just a competition. It's a collaborative platform where students from diverse backgrounds can design creative and practical solutions to some of the most pressing issues within healthcare. And we empower students to drive innovation, equality, and collaboration in our mission to reimagine healthcare, starting right here in Hamilton.
This year's theme focused on addressing the most pressing issues in patient care, from digital health access to preventative care, and participants worked closely to develop ideas with real potential for community impact. This event wouldn't be possible without our support from our sponsors and our commitment to build relationships within Hamilton. As we look ahead in the future, we focus on 3 key pillars: collaborative partnerships within organizations like the City of Hamilton, addressing local healthcare challenges through student-driven innovation, and creating a sustainable community impact that lasts well beyond our event. We see Healthcare Hacks as a bridge connecting passionate students with real community needs and partners like you who can help make those ideas a reality. Now, please join me in welcoming Heart Hacks, the winning team from our competition, who exemplify the values of this initiative, and we're excited to see the solution they developed.
Hello, everyone. My name is Kartik. This is my group, Ali, Kyle, and Ayan, and we're here to present AIMDA, our AI-driven myocardial infarction detection assistant. Our goal with AIMDA stands for, our goal with AIMDA is very simple. It's all about precision-driven, patient-focused care. We want to help ER doctors identify and diagnose heart attacks faster and more accurately, especially when the symptoms are atypical.
Now, what is the issue at hand? So the issue is well documented. When patients present with abnormal symptoms, their risk of misdiagnosis jumps by over 50%. And this disproportionately affects not only marginalized communities, but biological females as well. This is because research and diagnostic standards weren't built with these people in mind. So now it's almost come to bite them in the back. And at the same time, with this pressing issue, we need to find a solution that fits into the hectic ER workflow, such as AIMDA. We can't slow things down, and most important, it has to create equitable care. And I want to emphasize this with my experience in the ER. Over the past couple months, I've been shadowing some ER doctors, and I've seen just firsthand how hectic it can be. People are coming in all the time, and it's a fast-paced environment, and doctors don't always have time to dig deeper. More often than not, when a patient comes in and their symptoms don't align with the textbook, they end up referring, moving on, or sometimes they actually miss something completely. And that's the last thing we want. And you guys as a public health subcommittee, you guys see this every day, that there's more time spent, more money, more resources, and it just creates a general strain on the public health system.
So what is AIMDA exactly? AIMDA is an AI-integrated clinical support tool meant to help doctors assess risk of heart attack among their patients. Well, how does it do it? It draws from a large data set that includes a patient history, medication, ongoing research, and similar cases, outputting a probability, as you see on screen right here, about your patient's risk of suffering a heart attack. It is designed specifically to cater for abnormal symptoms that are not as common, helping doctors during and making decisions during moments of uncertainties, or even bringing up the probability of suffering from a heart attack in scenarios they never thought of before. But remember, this is a clinical support tool, so it will only help make a decision. The final decision will always be from the physician's point. And our goal with developing AIMDA is pretty simple. Easy integration into workflow, reduces ER wait times, reduces misdiagnosis chances, while increasing representation of marginalized communities that may not be represented as equally in research.
So our next steps are aimed on building a product specific for the Hamilton healthcare ecosystem. We would like to conduct research on patients based in the Hamilton area. So I'm sure, as many of you know, hospitals like Juravinski, Hamilton Health Sciences, and St. Joseph's have an extensive number of patients in cardiovascular care. By analyzing these patients' treatments, healthcare outcomes, symptoms, we can use this data to train our AI model to better help patients in the Hamilton area, as well as ER doctors.
So we do know we're on a time crunch, so sorry about that. But thank you guys for listening. We really appreciate it. I'd like to thank Healthcare Hacks for giving us this opportunity to speak. Moving on, honestly, any advisory from us on our validation process and any steps in piloting AIMDA, maybe any labs or hospital teams which we could look forward to, would be really appreciated. We're all really passionate. We all just finished first year, so we've only been a part of the Hamilton community for only a year now, but we really love to make a big impact on this community and leave it better than we found it. So thank you. We'd love to take any questions. And we also do have a video run through. It's about a minute if you guys are interested in seeing that, but we do know you're on a time crunch, so thank you guys.
Thanks very much. I will leave it to the committee to decide if they want to watch the video. That would require a small motion.
I'll let that motion go for right now.
Okay, so first on the speakers list is Councillor Taddison.
Just a general question. Who do we contact for more information about healthcare hacks?
Yeah, you can contact us at healthcarehacks2024@gmail.com. Me or another member of my team will be happy to help.
Okay, thanks. Statements now or questions? Okay, I'll just make a questions. Okay, I'll cede the floor to Tammy.
Thanks very much. These are just questions for delegates now, and then there'll be a chance to say something if you wish when we receive the presentation. Councillor Huang.
Thank you. I love a good hackathon, and I know that I've been a part of a lot of different hackathons. So could you tell me a little bit about how Healthcare Hacks is going out and doing that partner collaboration, and what is included in the research phase of your project? Like, who are you going out to talk to? What are the types of organizations? So could you just give me a little more understanding as to how you're getting the student teams to go out there and do that market validation?
Yeah, that's a great question. We really try and empower students to first find a problem on their own and then come to us for any sort of help and support. And we really do try making that connection between researchers at McMaster University and the team so that they can have just a better idea of what the problem is and how to best address it.
Okay. So are you connecting in with any of the hospital systems at all?
Not yet. This is our first year running the event, but we're looking to do that this year.
Excellent. So is there a opportunity in the future for looking at community consultation, or how do you enable the teams to go out and have conversations with community?
For sure. So that's something that we're really interested in, and we're hoping that this opportunity might facilitate itself here, or we're also going to be reaching out to other components of the city to kind of facilitate that, yeah.
Excellent. Just the last question then is, how many teams did participate in the 2024 Healthcare Hacks?
Sure. There's a total of 9 teams, and 5 teams made it on to the in-person presentation.
Oh, cool. Thank you very much. Those are all my questions.
Thanks very much. And now a question from Member Kirkby.
Thanks so much. That was really interesting. So the project seems to be very kind of clinical healthcare focused in its application. So just wondering, do you see any way of using the data that you collect through this for more preventative measures, or ways that it might align with public health in terms of like chronic disease prevention, that type of thing?
Yeah, so I actually ran out of time, but I want to mention we were looking at using research we conduct to create a sort of heart attack educational awareness program, maybe for elders in the Hamilton community, or even people aged in the 40 to 50-year-old range, just for example, like we can gain data on their symptoms and treatments and use this to create a heart attack readiness kit, simple things you have in the house, or even an educational awareness program about lifestyle factors, diet, stuff that you can incorporate into your everyday life to make sure the chance of a heart attack is very, very low. That's sort of our public health, I'd say, idea for this project.
Thanks very much. I don't see any further speakers on the list at this time. Thank you for your presentation. You can join us over here in the gallery again. And again, thank you for joining us today. We appreciate it. Oh, sorry. That'll come up in a second, Councillor Jadison. Yep. Thanks. You can have a seat in the gallery. At this point, we're going to move to receive the presentation, delegation. So I need a mover and seconder to do that. Moved by Councillor Jadison, seconded by Member Danko. Any discussion? Councillor Jadison.
Oh, I've been waiting. Anyways, I just wanted to say to the group, I really appreciate them coming here today. I know that the Health Hacks group actually gave up a beautiful summer vacation day of theirs to come here and make this presentation. I do see this as a positive step for Healthcare Hacks. I just wanted to share with our Public Health Committee that I had the privilege of being a judge at the Healthcare Hacks competition at the Wilson Hall at McMaster campus. I appreciate, I saw 5 of the presentations. Well, there we go.
Councillor Jadison.
Carrying on with my questions and something positive in our community, I'd just like to say that some of the topics that I saw involved access to healthcare for seniors, improving diagnostics, healthcare challenges in the far north, and virtual healthcare improvements. I was very well looked after by the organizers, Keith and Avik. No details were overlooked directions, parking, snacks, refreshments, materials for judging. Everything was bang on. And I just wanted to thank them for their hospitality and the opportunity to share my passion for public health with these enthusiastic students. And I would encourage all members of our new Public Health Committee to accept the invitations that I believe will be forthcoming from this enthusiastic organization in a future event. I also encourage members of Hamilton Public Health to help get involved as well. I believe when we, the city, actively forge and foster relationships with our institutions of higher learning, it helps their students better understand all the supports and services in Hamilton that make it such a great city for healthcare and future healthcare professionals. Thanks for coming in again, guys.
Thanks very much, Councillor Taddison. We'll have a show of hands vote on receiving that delegation. All those in favor? That's everybody. And just for transparency, I have to say that just so you know why I was asking someone to leave the chamber, it wasn't Councillor Taddison, but I wanted to deal with that as quickly as possible and let him finish. But someone did come into the council chamber just now, uttered a bunch of hate speech, and then I asked them to leave and they left. And I've asked security to go find the person and to speak to them and do whatever they normally do there and to follow up on that. But just anyone here who had to listen to that, I'm sorry. It was awful. Listen to that outburst. It was disgusting. We don't tolerate that kind of behavior in the chamber. I'm glad the person left immediately, but just want to say sorry about that, folks. On that note, we'll move now to the next series of delegations. And those delegations are on 6.2, delegations respecting the Hamilton 350 proposal for emergency heat relief. And so we have those delegations. First up, Miriam Sager from Hamilton 350, then Don McLean, Joanna Sargent, and Dr. Jim Quinn. And at the end, we'll receive those delegations, and if there's questions for staff as we receive delegations during the discussion, that'll be the time for that. Otherwise, questions for delegates. And again, you can lower and higher it from the left-hand side. There's a switch there. It goes up and down like a light switch. And you can raise and lower the podium as you wish. And whenever you're ready, the light will go on, and you can begin your delegation. Thanks, Delegate Sager.
Thank you, Chair, board members, especially welcome to the new members. I'm happy to meet you, and thanks to the staff as well. My name is Miriam Sager, and I'm one of the members of Hamilton 350 who will be delegating. Hamilton 350 is a grassroots climate action organization, and we are here to ask for your support for our proposal to make HSR fare optional on extreme heat days like today. I was going to walk here to make a point. I live 10 minutes away, but my friends kind of yelled at me to not do that. So I took their wise advice and I took a bus. And I am fortunate enough to be able to pay the fare. I am also fortunate enough to have a cooling system in my home, which I know not everybody has. We know that 44% of tenants don't have adequate cooling in their homes. There are lots of people exposed living outdoors still, unfortunately, and others who are exposed to extreme heat. By the way, we support the maximum heat bylaw proposal for sure. So climate change, the city recognized it as an emergency. Public health named it as one of the priorities a couple of years ago at least. And we've had a decade of record-breaking years, one after the other. 2024 we know has been the hottest ever, the first to break the pass the 1.5 Celsius threshold that was named in the Paris Accords in 2015. I understand that there's been a report last week about a big increase in emergency visits in Hamilton because of heat-related, specifically heat-related, identified as such, illnesses. And we know that in May, we passed the 430 parts per million CO2 in the atmosphere for the first time. This is guaranteeing us that heat will continue to rise, and we know that climate change is accelerating. It's not linear. We can't expect our emergency departments to deal with this additional wave. They're already overburdened, as we know. Heat strokes, heat exhaustion, worsening of existing conditions, which isn't always identified as related to the heat. Even though no heat-related deaths have been recorded yet, we know that extreme heat is the deadliest climate impact, actually. And we've seen many examples that we do not want to follow in their footsteps. In Montreal, 2018, 66 deaths during a 6-day heat wave. BC Heat Dome, 619 heat-related deaths in 2021. In Karachi, 2024, 450 deaths. And in Europe, just this past June, a 10-day heat wave, around 1,500 deaths are directly tied to climate change, as shown by a rapid attribution study that was held right after these 10 days. It's a looming public health crisis, and none of us want to just sit and wait until those unnecessary deaths, preventable deaths, happen here. The municipal cooling centers and cooling kits are great, but last summer, the city's focus groups heard people talk about mobility restrictions and cost as barriers to access. Low-income people can't afford to get there, and they might need to walk through the overheated streets, which is not a safe thing to do. And we know that low-income people are the most vulnerable in our community. In 2024, our proposal was supported in principle by the previous iteration of the Public Health Committee, but was transmuted into 2,000 free tickets, which is not the barrier-free solution that is needed for the most vulnerable people. And public health services in 2023 recognized the issues are complicated and need multi-partner collaboration and innovation. This is innovative. We know that this board does not have the authority to implement the proposal, but we need your support and hopefully also direction as to how to proceed to get this implemented in a timely way, in an urgent way, really appropriately, before we have to assess the damage in hindsight. Thank you.
Thanks very much, Miriam. Any questions for Miriam? I don't see anybody on the speakers list at this time. I'll just pause in case there's a spontaneous manual submission. One moment. Member Jacob, go ahead.
So I wanted to thank you so much, Miriam, for your presentation. And I think that it absolutely conveys the urgency of this crisis as it's impacting our city and its most vulnerable. I wanted to ask a question about precedents to this. So I understand that we've implemented similar initiatives with like Out of the Cold, where we have an initiative meant to ensure people are safe and out of harm's way. But are there precedents for going fare-free or fare-optional to ensure that people who are vulnerable have access to mobile cooling centers, or at least to get themselves to places that are cooler?
Not that I know of. I think this would be active leadership. There may be some that I haven't been able to find. There have been, in Toronto, they used transit to help people get to warming centers in the winter. And I really think that in Canada, we've long recognized the cold as a danger to human life, but we haven't recognized the heat. It never was this bad, but it's time that we give it similar weight. And the initiative we had here in Hamilton for the warming bus, I think worked well. It was officially discontinued because it was determined that there would be need for, it would be better to have drop-in centers. I think because the population that was using overnight warming was specifically unhoused people who are multi-challenged and needed more supports. And this is during the day when it would be members of the community. There might be unhoused people as well, but it might not be so complicated, and it's not as costly. The buses are running anyway during the day. During the hot hours, HSR is operating, the drivers are employed. We have great transit system that covers the city, and people won't have to walk through the streets to get to those wonderful swimming pools and libraries and everything that the city has laid out for them. There have been examples of the use of transit for dealing with natural disasters, like during fires or flooding in the US. So that's done in some locations, not everywhere. Obviously, the US isn't great with transit and disasters, I think. But, and there are cities and even countries around the world who are trying to, or have already implemented just free transit, zero fare transit for accessibility and for equity. So different causes by age, by income, and by physical ability, and access to accessing benefits, social benefits. Thank you for the question.
Thanks very much, Member Jacob. And now, Member Kirkby. You can ask a question to staff after. Yeah. Yeah. Okay. Thanks so much, Miriam. You can take your seat, and we'll have the next delegate come forward at this
Thank
time.
you.
I believe is Don McLean.
Thank you very much. I'm one of the people who probably shouldn't be out wandering around in this heat because of health implications that I have. But I appreciate that the board is here and willing to consider what we've been raising. I understand that the board can't require the implementation of the proposal we're making. I'm hoping that you will pass a resolution encouraging council to do so, or taking other measures that you see appropriate to advance the proposal. I have enough experience with city council and city procedures to know that this will take time and will be complicated, probably requiring a staff report and certainly input from the HSR. But we believe that it will have minimal cost implications. Most people who will benefit aren't riding the transit system now because they can't afford it. So there should be no loss of revenue. Miriam has raised the issue of the health implications and noted the item in last week's Spectator that the number of people showing up at the emergency departments with heat exhaustion and heat stroke is dramatically higher this year. One of the simple things that I hope your board can do is require such information to be tabulated and shared with City Council and our residents. Miriam also I thought Miriam was going to mention power outages, but there have been, I understand, a number of instances of power outages in various parts of the city. And many of us have air conditioning to help us cope with the heat, but what happens when the power goes out? I understand that it is being disrupted frequently in parts of the city. At that point, people who didn't expect to need heat relief find themselves desperately in need of it. Our proposal would help with this because it's not based on just an assessment of who is most vulnerable. I grew up in Southern Ontario and not knowing what air conditioning was. No one had it. Increasingly, it is becoming a necessity, and that has imposed a significant cost on people and is part of a growing impoverishment that we're all aware of. Over 10% of our population in Hamilton are using food banks. Hundreds more line up daily for free meals provided by faith groups and other charitable organizations. And the schools have now stepped up with meals for students. The basic requirement to have a roof over our head is also increasingly uncertain. and for some, not a possibility at all. Like extreme heat, these are fundamental health issues that are only getting worse. Hamilton has recognized the health implications of extreme heat. As a city, we identify heat emergency days, and we encourage people to take steps to protect themselves, as I mentioned in the beginning of my talk. We also open cooling centers for some hours in various places around the city, including our libraries, recreation centers, and swimming facilities. There's some limits on that. Yesterday was Sunday, and most of the libraries were closed yesterday, and that timing affects the availability of these centers. But we make these centers, these cooling centers, free on extreme heat days. We don't charge people to access the cooling in other facilities. Our proposal is really an extension of those principles. We have well over 300 mobile cooling centers called buses that run all over the city most hours of every day. Surely we can take the step of making those available for those who cannot afford them when they need them. Thanks very much.
Thank you. Speakers list is open, so if there's any questions for the delegate. Councillor Alex Wilson, please.
Thanks, John, for coming, and thank you for bringing back the proposal. Implicit in it is an understanding that the existing solutions either don't go far enough, don't reach the right people, or there's a need to have like a more universal baseline when it comes to access to cooling. So the mobile buses is kind of one of those I think the group has identified as like a low-hanging fruit or easy because the buses are running. Are there other places of a more satisfactory response, more urgent response, emergency level response? Like what else? Because I'm assuming if the buses were free on heat days, the problem's not solved. And so what are some of the other pieces, just if we're sketching out what a comprehensive response looks like that you and the group have been talking about, or you as an individual would find useful?
Well, thank you for the question, Councillor Wilson. Our group is focused on climate change and the threat that it poses, and it's certainly been recognized by the city. I sit as part of the heat emergency working group at the city, and the fundamental problem is the continuation of the damage to our atmosphere, ongoing damage to our atmosphere, and that has to stop. It has to stop as quickly as possible. So that's fundamental to this. The city has declared a climate emergency. It has taken some steps through the Office of Climate Change Initiatives, and those are helpful. We need more. We are particularly hampered in Hamilton and other municipalities by the failure of senior levels of government to take this seriously, particularly at the provincial government level at the moment, where we effectively seem to be operating on a basis of that climate change is a hoax, or climate change really isn't important at all. All you can do in that position, I think, is advocate, and I think you need to continue to advocate. I think it's also would be valuable to be more of a commenting agency than you are at this point, even recognizing that we can't deal with all the problems ourselves here at the municipal level. As a Board of Health, you would seem to have a voice that you can utilize to point out what is happening as a result of climatic changes and why change has to occur and the steps that the city can take in that direction.
Thanks very much for your question, and thanks very much for the answer, Don. I don't see anybody else on our list, so thank you so much. You can have your seat, and we'll go on to the next delegation, which is a virtual delegation. And we see that Joanna is joined here online with us. And Joanna, you can begin your delegation whenever. I'll let you know when the 4-minute mark and 5-minute mark are if you get close, because you probably won't be able to hear the ding very well from where you are. So go ahead whenever you're ready.
Thank you very much. Hello, my name is Joanna Sargent, and I am a member of the Hamilton 350 group, here to ask for your support for our emergency heat relief proposal. Thank you for the opportunity to speak to you about this public health issue that has been breaking my heart, and one I'm sure you're equally concerned with. It's that terrible health effects of extreme heat and the suffering that is endured probably the most by people who are the most vulnerable. Our group has come up with a proposal, as you know, to present to City Council on a way to provide some emergency heat relief. Our proposal to Council reads, quote, "On days when the city declares a heat emergency, the city supplement its cooling centers by making HSR buses fare optional," unquote. As you all know, the impacts of extreme heat are more severe for these people who are most vulnerable. This would include people who cannot pay bus fare. Groups most at risk to heat include children, older adults, especially those over 65, people experiencing homelessness, people with pre-existing conditions, people with disabilities, pregnant people, and low-income communities. I was encouraged to come before you to ask for your support when I read statements on your website about what you do. The quote is, "Services and supports to improve and protect the health of Hamilton's population and reduce health inequalities. Now, we recognize this board cannot implement the proposal, but your support would be most valuable when this goes before City Council. It seems the previous health board recognized the importance of this proposal as they had agreed to support it. Other organizations that have endorsed our proposal include the Council of Canadians, Hamilton chapter, ACORN, the Hamilton Centre for Civic Inclusion, Hamilton and District Labour Council, Environment Hamilton, and the Hamilton Community Benefits Network. Finally, please note this proposal is a low-cost measure because HSR is already operating throughout the city during the hottest hours, and the drivers are already working anyway. Since fares would be optional rather than free, some revenue should still be expected, although perhaps at a lower level. While it is reasonable to ask about this cost, the answer must weigh that number against the cost of not providing more emergency heat relief such as this. Those costs to the healthcare system include extra emergency room visits, more hospitalizations, and deaths from heat-related illnesses. We must not ignore opportunities to alleviate these healthcare costs. It's much like providing vaccines during a pandemic. Some cost is involved, but is clearly the right economy. Please give this proposal your support and relieve some of our concerns about those vulnerable people affected the most by this extreme heat. Their suffering breaks my heart, as I'm sure it bothers you as well. Your support for our proposal will help us to reduce this type of health inequality, reduce healthcare costs, and ultimately help protect public health. Thank you.
Thank you very much, Joanna. I'll now look around to see if there's folks with questions. I don't see questions at this time, so you can log off and watch the rest of this on YouTube, and we'll be probably dealing with this a little bit in the discussion period and then likely under the motion section of our agenda. Have a great day, and thanks for delegating today. We'll go on to our last delegate. You're welcome. We'll go to our last delegate, who's in person today, is Dr. Jim Quinn, also from Hamilton 350. And Dr. Quinn, as soon as the light comes on, you can get going.
Hello all. I hope you all have a cool day today. As I came in this morning, I had to pass by the tape that surrounds an area that used to have people that were in an encampment. The Hamilton Encampment Support Network folks were taking very good care of those people. I wish the city would do that kind of thing. People that are not able to afford a home, people that are not able to afford to go on the bus, etc., represents a very clear case of climate justice, a problem with climate justice, an issue with climate justice. And the four of us that spoke are on a subcommittee in Hamilton 350 called the Social Justice Committee. Now, I just got back from paddling 150 kilometers on the Grand River in the 2-row paddle on the Grand, so I'm a little bit out of the loop. During that paddle, we experienced some very, very hot days. We got to experience what it's like to suffer hot days without an opportunity to cool, other than dipping your hat in the water and putting it back on, which was helpful. We had good support from the people that ran this, and so we were not suffering that much. I rode my bike here today. It was of my own choice. I am a person with sufficient money. I can make these decisions. I'm coming to an air-conditioned place, and I'm going back to a heat pump air-conditioned home. Some people do not have that choice, and those people without homes and cooling, or homes with cooling, need to be protected. And I think this initiative is a very obvious approach, and one that should definitely be taken. It seems like it's like falling off a log. It's the obvious choice, and I really hope you folks will support it. Fare optional bus travel is an obvious direction to go. A way to help people. I expect that there will be financial concerns by the HSR. I would hope they would weigh those against people's lives, against their health, against the costs, as Joanna said, to the healthcare system downstream from people getting exposed to extreme heat on those days. I would also encourage that you folks support or suggest that the HSR manages to find a good way to encourage patrons of the HSR who would normally be paying to get on the bus as they normally would, while affording those that cannot pay the dignity to get on the bus without having to expose themselves as being unable to pay for the bus. So I think socially it would be an important thing to do. Finally, I'd like to read from a document that was written in 1994 by the City of Hamilton's, what are they called now? The people that do all the work behind the scenes, I've been on the river too long, the staff, the city staff. So this is from city staff. Focus group discussions identified various barriers to cooling access during extreme heat events, such as cost, i.e. purchase, operation, and maintenance of air conditioning units, close quote, close paren, and mobility restrictions. While the facilitators to cooling access included financial and cooling infrastructure supports for urban pedestrian travel, i.e. decreased exposure to uncomfortable elevated air temperatures while walking, moving in Hamilton's urban areas. What better way to do this than to offer free access to air-conditioned buses? I hope you will support our proposal and push hard if you can so that the HSR will make this happen, and as soon as possible. It's unfortunate that the way the system works, there are going to be people exposed probably all summer, but please let's not let them be exposed next summer. Thank you very much.
Thank you, Dr. Quinn. I'm just going to look around to see if there's anyone with questions at this time. If there's not, so I'm going to pass the chair to Councillor Huang because I have a question. So I don't raise my own hand as a chair, I guess. So I just wanted to ask you quickly, one of the things that I think about, and I think Councillor Alex Wilson was speaking to this, I'll let it step out briefly so I didn't hear the whole question, was no, this isn't necessarily going to solve a problem for everybody who's experiencing heat risks. One of the things I've heard about this is that when I've spoken to experts or other people who are working with folks who perhaps are deprived of housing and they need to be near supports and can't necessarily be taking a bus ride forever farther away from where they are. This can kind of remove them from those supports and so on. So one thing I think about, though, I wonder what if you can comment on this, was, if you already said this, I'm sorry, which is respect to individuals who are out in the heat and they're making a choice. I'm thinking about taking the bus to get to my appointment, can't afford to take the bus to get to my appointment. I'm going to take my walker and go for it. and try and make it there on my own. So, do you see that group of individuals at risk specifically here?
Absolutely. They are also at risk. Those are people that hopefully will recognize that they can avoid heat stroke, that they can get to work. Some of them have jobs and they have to get to work, and they don't have a way to get to work other than walking. This would provide that important option. Also, as has been mentioned, a maximum temperature bylaw of 26 degrees is something that Toronto has, I believe it's almost in place, at least for some situations. And hopefully the city of Hamilton will follow in that as well as supporting people in encampments in a better way. I mean, providing housing is the obvious best way. However, there are other things that can be done, and those things were seen when there was a freedom camp in front of City Hall, and they were seen recently when there was an encampment that was supported by the Hamilton Encampment Support Network. Take care of people. Don't leave them to the conditions that might harm them.
Thanks very much, and I'll take the chair back, and those are the questions from folks, and you can have a seat to watch the rest of the meeting. Thank you very much,
Thank
Dr.
you.
Quinn. On that, we'll now take a mover and seconder to receive these 4 delegations, moved by Member Kirkby, seconded by Councillor Nan. And at this point, we have an opportunity for discussion. Before we get to the discussion, just a couple things from me as the chair. So my job is to try and do as much homework in advance of meetings to make things run smoothly and to listen really carefully when things are posed on the floor to bring options to the committee for their consideration. So 2 things. We have a few options in front of us. We could, in the motions section, not now, but later on in motions, we could move a motion that says we direct the Board of Health to come back with a report on this so we can have something to actually endorse, some recommendations. I'll caution you that that's going to take a certain amount of time. And already, if you don't know, the HSR is being directed to report back to the General Issues Committee about this very issue. So what happened before was the Public Health Subcommittee endorsed this in principle, moved it along, and the outcome of that was that there'd be a report back from HSR to GIC about this topic. And so we could direct public health staff to participate in that report. And then they would actually be able to provide the recommendations to the existing report already. So all the information would come back in the same place rather than in 2 separate places. I also heard in one of the delegations a request for providing information with respect to heat-borne illnesses and deaths, and if we could track those and report them. And so I did a little homework on that again before the meeting and let you know that we already do that, actually. It turns out we track illnesses and deaths. We don't necessarily report that information publicly. So under the motion section, we could also just have a quick motion to request that public health staff report that information online through our web portal so people can all access that. And that would happen whenever we got the information. So I'm saying all this now so that you have an opportunity to think about any motions you want to bring forward when we get to the motions section. That's it for me. Any other questions for our staff or discussion that anybody wanted to have at this point with respect to the delegations we heard? Member Kirkby.
I just want to thank the delegates for the timely delegations as we move through another heat warning today. So I just had a question, a fairly specific question, but just around the data from the performance and accountability report that I think will help inform some decisions. So it was, I believe it was over 1,500 free tickets were provided to individuals last year to travel to and from cooling spaces. So do we know through any of the data collected or kind of contextual data if we're missing anyone through this approach, particularly those who are most at risk? I'm just trying to understand if you have a gap in what's currently being provided. And I understand through the delegations that there's some concerns that we may be missing or that those who could use the transportation for other reasons, not necessarily going to and from a cooling space, but to an appointment or other reasons might be missed in this. So I'm just curious if we know, if we have any other information collected around this that might help inform some of this decision making.
Good morning. Thank you for the question. Member Kirkby, Matthew Lawson, Manager of the Health Hazards and Vector-Borne Disease Program, Public Health Services. With respect to the question of is somebody being missed, that's the $1 million question in any kind of health outreach and promotion campaign. And but I can assure you that the tickets that were distributed along with cool kits were done so using the latest census data that indicate the greatest at risk and the most vulnerable in our community through the University of Laval mapping tool that has It maps an environmental heat component as well as socio-demographic variables that indicate vulnerability to cope with extreme heat. And so those neighborhoods within the city of Hamilton were our focus of our outreach through recreation centers and the agencies and groups that help make up the extreme heat working group that Mr. Don McLean mentioned that today, the extreme heat working group that we have been using as an engagement avenue to people to give opinion and evidence and information to us as we develop our outreach on this matter. So those 1,500 tickets were distributed through those avenues. I will say that the promotion might have been, we've received feedback from some of our distributors through the recreation centers, is the information could be promoted more at the centers, given that we did have those 2,000 tickets in 2024, and we only ended up distributing 1,500 of them by demand. So there was a lack of demand there that we've taken the extra 500 and we're rolling them into our effort this year, which we're still distributing cool kits, and all the cool kits contain 2 HSR tickets as well for individuals who may be at risk. They do have a couple of tickets at their availability to use if needed.
Thanks very much, Member Kirkby. Anybody else wanting to have discussion or questions for staff about the delegations we heard? Otherwise, we will wait until motions. Member Jacob, go ahead, please.
So thank you for clarifying that we do track heat-related health data. I wanted further clarification on what kind of data we track, specifically in the instances of individuals having pre-existing health conditions. How is that data sorted so that we can say with certainty that someone had a health reaction to heat?
Through the chair. So in terms of the tracking that we do, we began doing this last year and are using data from both the ER visits, the emergency room visits, as well as information from paramedics in terms of the calls that they get. It isn't easy always to use data in ways that we might think might be available to us. Indeed, we don't actually have death data available to us right now. We just have those 2 sources. And so we are tracking ED visits specific to heat-related illness. It is one of the challenges is if there's been an exacerbation of an existing condition during a heat event, it's very hard to sort that out. And so we don't track that separately at this point. But I'm just going to turn to Director Prieto to see if she has anything she wants to add.
Thank you, Dr. Richardson. Through you, Chair, to the member. So just clarifying with our epidemiology manager that it is paramedic response and emergency complaints, but it is pre-diagnostic. So that's the information we have at this point.
Thanks, and if I could just maybe ask the follow-up question, the factual one. How would we get that information? How would it be possible? We don't currently have some of it, as you're saying, but is there a way to get it, or who would have that information?
So through the chair, the challenge with the deaths is the timeliness of the data. So we get very timely data when it comes to opioid response because that was a specific initiative that was undertaken by the coroner's office. And so we're getting that information flow very quickly, and they're actually adding an extra layer of investigation to the deaths so that they can provide additional data than they would usually. So there's not currently any such initiative related to heat-related deaths that's going on with the coroner's office. When it comes to the exacerbation of other illnesses, we can look at methods to do that. I think we first wanted to get this piece down and see if there's a way to do it. It's difficult to track all the reasons why that might happen at any given point in time. So we can look at that, at adding those pieces into diseases that are specifically exacerbated by heat. But so far, we've been tracking heat-related complaints and paramedic responses.
Okay, I'll leave that out there for food for thought. You can always bring a motion forward at a future meeting asking that the Board of Health request the coroner do something similar, right? So that's not for us to do, but we can always ask the coroner to do stuff as a Board of Health. So I'll leave that out there for folks. Not seeing any of their hands up at this time. We have a mover and seconder ready to receive the delegations. All those in favor? Thank you very much. And so we're moving on in our agenda to One moment, I'm just going to make sure I'm in the right place. Yep, 6.3, it's a delegation from Adam Christie, Niagara Peninsula Conservation Authority, respecting item 9.1, motion respecting beach water quality testing and advisory protocols at the Binbrook Conservation Area. So welcome Adam to come up. Same story for you, Adam. There'll be 5 minutes for your delegation. There'll be a ding at the 4-minute mark for a reminder, and then there'll be a ding at the 5-minute mark. And if you're going into the 6-minute mark, I'll say hello.
Thank you for having me today. This will be very brief. I'm Adam Christie. I'm the Director of Conservation Areas with the Niagara Peninsula Conservation Authority, here representing the MPCA, where we have a bit of a unique situation where we have conservation areas within 2 different upper-tier municipalities, which leads to 2 different public health agencies. So currently, about 5 years ago, we started working with the Niagara Region Public Health in transitioning to doing our own beach water testing at our Niagara conservation areas. That's been completed and done and been incredibly successful over the last 5 years, and it allows us to create our own real-time, more of enhanced customer service messaging within our Niagara beaches. The issue lies is that currently one of our more popular parks as well is Binbrook Conservation Area. And Binbrook Conservation Area is obviously within the upper-tier municipality of Hamilton and funded by the Hamilton Public Health Jurisdiction. So we currently have conflicting messaging when our signage is different, the website's messaging is different. So for our pass holders, for our visitors using the sites, they are receiving conflicting messaging with going back in between our Niagara and Hamilton conservation areas. So today I'm just here to hope we can start working with staff to make a transition to do our own water testing. So happy to answer any questions.
Well within the time limit. Just looking around here for questions. I see Councillor Taddison.
Thanks for coming in today, Adam. Basically, when we're dealing with Lake Niapenco, where can contamination come from?
Well, we deal with, sorry, through you, Chair, a variety of different contamination, but our main when our beach water testing is we worry about E. coli levels and we worry about, blue-green algae.
Okay, thanks.
I should mention that our CAO and boss, Lynley Yates, is also online here for any questions for her as well.
Okay, thank you. And then I guess we're here basically because people sometimes get sick when they swim in natural bodies of water. So what are some of the main ways that people would get sick if they swam in natural bodies of water?
Thanks for the question. So I should clarify that, and this is great, that the MPCA's water testing program the protocols is the exact same as the City of Hamilton. They follow the exact same guidelines. The only difference would be there's just a slight difference in communication and how we communicate to our guests through signage. It's a little bit more of a risk-based approach. So really encouraging people using ours to not drink the water, wash their hands when they're done, giving them information on when would be a time that they would experience higher E. coli levels. These are all the same the messaging we try to convey that we think is important to avoid what you were mentioning.
Okay, thanks. And then just my last question would be how does NPCA communicate this safety information at the beaches where they monitor their water?
Yeah, so through you, Chair, the MPCA takes our water testing and results and communication very seriously. And because Binbrook Conservation Area is a park that we charge admission to, we really want to create an extra level of customer service. So it starts with our website where we communicate the results weekly of our testing that we do, and as well as many other risk-based communication methods through our website. We add it to our social channels. But then also when we get to our gatehouse staff are there. We can update in real time different things we see, visual inspections, because our staff are there daily. And then that leads to our park signage that is consistent through all of our parks as well. So we do feel like we can create an elevated customer service through signage and several other channels.
Okay, thanks, Adam. No more questions.
I don't see anybody else on the speakers list for this delegate. I'll look around again with my eyes. No one. Thank you so much. You can take your seat and watch the rest of the meeting on YouTube. Executive Director, thanks for being here. I have a mover and seconder to receive this delegation? Moved by Councillor Taddison, seconded by Councillor Alex Wilson. All those in favor with a show of hands. That's everybody. Thank you very much. And now we're moving on to section 7.1, which are items for information. And so this will be a recap of the Board of Health 25014 Public Health Services 2024 Annual Report and Accountability Report, I believe. And I'll turn it over to Dr. Richardson.
Thank you, Chair. So very pleased to present to you today our annual performance report. And I'll just ask clerks if they can display the presentation. Just give it a moment for that to come up. Maybe while they're doing that, I'll just remind you there's a broad array of programs and services that we do provide that cover the whole gamut of health protection, disease prevention, emergency management, health promotion and policy development, and assessment and surveillance. So all of those core responsibilities for public health. And then here in Hamilton, the Board of Health also provides services that go beyond the Ontario Public Health Standards. So for example, our Child and Adolescent Program, which is a children's mental health program, our alcohol, drug, and gambling program. The annual performance report that you see this year really focuses on the OPHS pieces. We were a little hampered in 2024 and 2025, as you know. Next year's report will be more fulsome in looking at the full suite of services. So this next
Thanks.
slide.
Just before you get started, just wanted to check to see if you think this will be 10 minutes or if you'll need more time, because if you need more time, we'll need a motion.
It's probably going to be a little bit longer than that to go through.
How long?
I would say probably 15.
Okay, so I have a mover and seconder. So moved by Councillor Alex Wilson, seconded by Councillor Taddison. Sorry there, Member Kirkby. He beat you there just by a hair in the great contest for who gets to be the mover and seconder of procedural motions. All those in favor of granting additional 5 minutes? Thank you so much. Go ahead.
Okay, so if we can have the next slide. I'm not sure, Sal, if it's you that's doing slides? Yes, thank you. So as I said, we're going to focus in on the Ontario Public Health Standards. Just a reminder that there are a number of key reporting requirements that we have to fulfill to the Board of Health, to the Ministry, and to the public. And so we have to do an annual report and attestation to the Ministry that talks about our fulsome program achievements, our financial summary, and demonstrates compliance with all the programmatic and organizational requirements. I think there's about 63 in total about organizational requirements alone. And then we have to also report that in a way that's consumable to the public. And so what you see appended to your report today is the overview of the report, or sorry, the full report, which is the annual report to the public. So just on to the next slide. I just want to put it in context as well as we're moving forward, as we're making this transition for the Board of Health. So you're going to see in this year some more reports that are coming forward that talk about our planning moving into 2026. Always a challenge, 24, 25, and 26 in play at the same time. And so in September, you're going to see a budget variance report that looks at our performance thus far in 2025. We're also going to take some time during that to go over the budget process and to give a high-level overview of the budget for 2026. And then we're going to bring to you in October the proposed, an overview of the 2026 priorities for the board. We're going, as you know, we're out meeting with folks right now to talk about those a little bit more. And we're going to have a proposed budget report that also goes that day. And then ultimately that budget, we would look for approval in the November Board of Health, and then it would be presented to City Council in January of 2026. So coming back to our performance, I'm going to talk about the administrative sort of pieces. Sal, if you can go to the next slide, and then my colleagues are going to talk about the priorities. So of the 63 organizational requirements that we are required to be compliant with, there are 58 of those where they're fully met. 5 of those, they were partially met, largely due to the operational disruptions that we experienced over the last year or so around doing things like reporting on things on our website. We didn't get to all of our moderate risk food premises. We hit 95% of those as opposed to the full 100% target because we were trying to balance with getting the inspection data updated and into the web-based reporting system. Some of our financial reports weren't submitted on time, but each time we checked in with the ministry and they were understanding of the delays. And we are working on updating our policies and procedures, which we're supposed to do every 2 years. We expect to be substantially through that in 2025, but may not get there until 26, which will put us about 3 to 4 years instead of 2. So going to the next slide. Oh, we've lost Sal, Matt. So you'll remember that as part of the 2024 annual service plan and budget, we had these 4 broad priority areas that we were focusing in particular. So health equity, mental health and substance use, child and youth health, growth and development, and climate impacts. These, of course, are long-standing issues, and so you see that they are also our 2025 areas of focus by and large. And so I'm going to turn to each of the leaders who are here today, starting with Julie Prieto, who's going to speak to the health equity priority. So Matt, if you can go to the next slide.
Thank you, Elizabeth, and good morning, everyone. Julie Prieto, Director of Epidemiology and Wellness Division. So I am going to provide just some key highlights from our health equity priority area. So under the Community Collaboration Action area of the Health Equity Priority, one area that we are especially proud of is the implementation of the Public Health Services Indigenous Health Strategy. In 2024, a key aspect of this implementation was the formation of the Indigenous Wellbeing Advisory Circle. The circle has been brought together to help support non-Indigenous service providers to improve cultural safety and access to care for the Indigenous community. It acts as a trusted voice for community and organizational interest holders, offering expertise and cultural perspectives to ensure health programs and initiatives are inclusive, are respectful of First Nation, Inuit, and Métis knowledges and practices, and are culturally safe for Indigenous peoples. The circle is made up of Indigenous leaders from Indigenous organizations in Hamilton and Indigenous leaders from other organizations like Hamilton Health Sciences, St. Joe's, McMaster University, and Hamilton Wentworth District School Board. The circle also includes community members and people with knowledge of health services offered by Six Nations and Mississaugas of the Credit. This is an important step forward in fulfilling the recommendations that came through in the Indigenous Health Strategy. I'm also going to highlight under the Data for Equity Action area a focus on improving how we collect and use data on the social determinants of health. So as you know, better data helps us better understand what's driving health inequities in our community and really does allow us to tailor programs and services to meet community needs. It also allows us to monitor whether our efforts are achieving the intended impact on the community. In 2024, we're really happy to state that all public health programs develop health equity key performance indicators to monitor and reduce local health inequities. So really, again, noting that this is a big step forward in helping us track where gaps exist and working on closing them. So I'm just going to hand it over to Bonnie King.
Good morning, I'm Bonnie King. I'm the Interim Director of the Healthy Families Division. And I'm going to share a little bit about our Optimal Prenatal Health Action area, which is within the Child and Youth Healthy Growth and Development priority. I'd like to highlight a program success in supporting the needs of pregnant individuals, their infants, and families. We know providing the right support during the prenatal period can help prevent complications, improve birth outcomes, and give children a healthy start to life, which we know contributes to better lifelong health outcomes. The Healthy Babies, Healthy Children program, our home visiting program, is one important way that public health nurses and family home visitors support pregnant individuals and parents with children from birth to school entry where they live. Some key highlights from 2024 include the achievement of 40% of pregnant individuals in Hamilton were able to access our prenatal supports, which was significantly higher than our target. The Healthy Babies, Healthy Children program in Hamilton completed over 900 prenatal screens, which helped identify the needs of expectant families and enabled us to connect them with the services that support healthy pregnancies and healthy birth outcomes. And lastly, at the time of discharge from the Healthy Babies, Healthy Children home visiting program, over 96% of one-parent families identified that they felt they had met their goals for healthy attachment with their child. Next slide, please.
Okay, so back over to me, and I'm going to provide some progress highlights on the mental health and substance use priority area. So under the harm reduction action area within this priority, we're really proud to note that in 2024, we re-engaged the Hamilton Drug Strategy Steering Committee to really identify priority substances. We recognize that strong collaboration amongst partners is really key to responding to the complexity of substance use in our community. The Hamilton Drug Strategy is an important citywide effort that brings together community members and partners to tackle the harms of substance use. It focuses on addressing system-level gaps and implementing evidence-based practices to reduce the impact of substance use in the community. So in 2024, the steering committee identified alcohol as a priority substance of concern that really required attention, along with the ongoing priority work centered on opioids. Strategic plans advanced through the alcohol and opium working groups are in collaboration with community partners. Also noting another focus in 2024 was strengthening our approach to trauma and violence-informed care. We recognize that how people engage with public health matters, and for some, past trauma or systemic harms can make the engagement more difficult. So that's why we began integrating trauma and violence-informed care into our programs so that our services are culturally, emotionally, and physically safe for everyone who walks through our doors. So this included staff training and beginning to develop an organizational-wide policy to guide our efforts and improve the safety and comfort of public health spaces. So I'm going to turn it over to Matt.
Thank you very much, Julie. Matthew Lawson, Manager, Health Hazards Vector-Borne Diseases Program, Public Health Services. So finally, under our extreme heat and health action area within the climate impacts priority, we are pleased with the work that we've achieved as part of the community heat response strategy due to the involvement of both staff, community members, and elected officials too. So some of our 2024 performance highlights related to this include nearly 750 cool kits being distributed to individuals identified as having high vulnerability to extreme heat, the launch of a real-time heat-related illness situational report to monitor the local population health impacts and extreme heat, which we've spoken a little bit about that today at this meeting. And in partnership with the cities of Hamilton's Recreation Division, more than 1,500 Hamilton Street Rail bus tickets were distributed to help residents access designated community-wide cool places during a heat warning of any duration. And I will give it back to you, Dr. Richardson, to wrap up.
Just the last slide, if you can, Sal. So that's the wrap up on our report. Just a reminder that, you know, with the status of transition in our financial systems, there may be some updated information that that comes up as we finish that off, and so any numbers will be updated as we go forward. We do have as well our 2025 priorities, continuing, of course, to have action done on those, and so we are now planning for our 2026 priorities. Really appreciate the availability that all have made to us coming to meet with you and talk about these issues, and that's going to be incorporated into our planning, and you'll see more about that at the October report, as I mentioned. If you want more detail and a lot more in-depth pieces, you can turn to the more fulsome report and see more there as well. So I think that's it from me. Thank you very much.
Thank you very much, Dr. Richardson. This time we have a speakers list. I believe Councillor Huang is on it. Anybody else, please join the speakers list any way you can. Councillor Huang.
Thank you. Through you, Chair, just a question on the health equity piece. Director Pareto, I always ask a lot of questions around data and how are we capturing that data? So I wonder if you could just dig a little bit deeper and talk to us about how you're capturing the health equity data. What are the sources that you're getting this from, and how do you continually keep it updated? Because data is hard to keep updated, especially because it gets stale very quickly. So I wonder if you can just give us a touch more information about that.
Thank you for the question. Through you, Chair, to the councillor. It's a very good question. So a couple pieces, particularly around health equity, that we wanted to highlight for 2024 was, of course, our community health status report. And so we did our best to weave health equity data into that report where it was available. So just want to put it there that, you know, again, we do use secondary sources for that data, and so it's just not always available. Or sometimes we have challenges with the quality of the data itself. So that's what we're doing. And as we continue to work towards our population health assessment strategy, this will be key. And a key component is the health equity data and our ability to sort of integrate it into those reports. The other piece is we do talk about KPIs, and so we are looking internally at our programs and services, using data to identify our priority populations, and then creating these key performance indicators to really identify the impact that we're making on our priority populations. So that's more internal facing. That really is important work that we're doing, again, to really align our services where they're most needed with our priority populations. And another key piece is then that follow-up evaluation work that's being done as well.
Okay. My follow-up question through you, Chair, is how, I know you've answered this before, so I just wanted to just ask the question again. How closely do you work with PHRI, the Public Health Research Institute, and any other sort of data gathering sources similar to paramedics, fire, police, or anything like that? How closely do you work with other organizations that have access to data?
Thank you again, through your chair, to the councillors. So we are doing our best to connect, particularly with some of our local partners, like our paramedics, for example. Not necessarily fire so much, but where that potentially could be useful for us, it is a relationship that we would develop. The other important piece is that we are well connected to the Greater Hamilton Health Network and their table around data, as well as some of our hospital partners. So really wanting to make sure that we're collaborating and connecting, and so that we have sort of overall a plan within the city of Hamilton, and a way in which that we can talk about data, I think, in a similar way, and appreciate the impact and the importance of that data on our programs and services.
Excellent, thank you. My last question is to Director King. I'm a big fan of your LEAP program. I can't remember what it stands for, but ultimately in Ward 4, we do have a lot of young families, and I really appreciate how integrated your LEAP coordinators are. I wonder if you could just give us a quick overview, but also just how is that program going, and how are we making a marked difference when it comes to young parents with young children of their own, and how are we educating them and getting them really contributing back into society?
Thank you. Through the chair, that's a great question. I'll just clarify. LEAP is Learning, Earning, and Parenting, and it's actually a program under Community Services aligned with Ontario Works, but we have a strong connection with them. And so to answer your question in terms of how we're supporting young adults and teens, we have a number of programs that are really important. So our Nurse Family Partnership is targeting families that are age 24 and under. It's an intensive public health nurse-led visitation program. And a big piece of that is education, but also really identifying the risk factors and things that families are struggling with and getting them connected to community-based supports and services. And LEAP would be a really important support and service for those families, particularly, to help them complete their education and consider job opportunities and even, vocational training beyond that. So we do get a lot of referrals during pregnancy for young parents. And so we really try to connect with them, understand what their issues are, and then really let them direct in terms of what types of programs and supports would best meet their needs.
Okay, thank you very much. Chair, I think that this is one of the challenges that I have as putting on my counselor hat, is that we have so many different departments. They all kind of interrelate with each other. So just as I've made that mistake of saying LEAP was under Director King's portfolio, but in all honesty, it's actually not. So I think that there's a real challenge with trying to figure out where do all of the different programs lay. But also, is there an opportunity to here at this Board of Health, how much more interconnected we are with the other groups in the city of Hamilton. My worry is that we start to become just the Board of Health, even though we are here to also dictate policy for the city of Hamilton, and sometimes we just need to understand how interconnected they are. So I wonder through you to Dr. Richardson is how do we connect our Board of Health with the greater city of Hamilton and ensure that we're doing a really good opportunity of breaking down silos and actually working better together with the other departments of the city of Hamilton?
Through the chair, so It's a great question. I mean, you're absolutely right. There's so much integration, either existing or potential, that can really, addresses the real nature of the issues that we're trying to improve upon. And so you see that in these, big issues that underlie the health status of Hamiltonians that we talk about as our priorities. So a few ways that we can do that. We remain City of Hamilton staff and we remain embedded within. And so we continue to do collaboration, reach out, have relationships, of course, with staff that are there. There's other ways, though, too, that it can be helped. So, for example, today when we spoke about the cooling piece and talking about public health staff going back and supporting that report that's going forward, rather than seeing these go on two different tracks, but rather to ask for those things. And I think particularly for councillors who are aware of the other things that are going on, you may be seeing things that we're not aware of. And so, whether you're in a council meeting or committee, or whether you're in this one, or whether we're having conversations, as we've been doing over the last several weeks, you can continue to make us aware of those opportunities and, as needed, direct us to collaborate with those opportunities as we go forward. I think the more we're clear that council understands and this board understands the complexity of those that are involved and reflects that in what you're asking of us as well, that helps as we're addressing the issues.
Thanks very much, Councillor Huang. Up next is Councillor Alex Wilson, followed by Member Kirkby. Councillor Wilson.
Thank you. Through you, Chair, just a couple questions on kind of the next couple of months of this committee. So seeing that in October we're getting the draft budget proposal for 2026, wondering what other program evaluation reports may be coming between then and now, or what additional information is coming in. So this kind of highlights some KPIs within the 4 priorities. Wondering if there'll be any kind of program-specific evaluation. Extreme heat, for example, is one of the things discussed today. Just trying to understand what some of those next steps or future reports might involve.
Through the chair, so at this stage, I don't believe there's any further performance type reports that'll be coming forward to the board. There are occasionally some that will be done at the staff level. A lot of that work is done in the continuous improvement realm of the managers and staff working on the services. And then you see these larger scale performance reports as they come forward. With the added detail, as I was saying, in the attachments, in addition to what we saw on the slides today. It is something that you'll see in the 2026 priority overview. Usually we do, again, come back and say, okay, how did 2025 do? What's a quick snapshot? Because, of course, the year's not over yet when we're reporting on it, to give some idea of the progress that has been made in the current year. So, as I said, not anything in particular that's a program evaluation. Those would be done at the program level. But there will be some more performance data in addition to what you saw here today.
Sorry, are you able to unpack that very last sentence? So we're not going to get in from any more further reports, or that's not anticipated. And then I understood that, no kind of challenging there, but just the last piece, but there is going to be some more information coming forward. What is the more information coming forward? Is it just the interim 2025 report back that you were mentioning?
So as I was noting about in the presentation, we'll look at the 2026 priorities, and during that presentation, we'll reflect back on what has happened in 2025 related to the priorities. So it's not going to be in-depth programmatic data, but it will talk about the progress that we're making on the action plan for the 2025 priorities.
Okay, thank you. And I think part of my question here is, so one of those action items, climate impacts and extreme heat, one of the sub-points under that is a community response plan. And so there's a multi-year kind of upskilling going on in there. Some city departments are taking it on within the public health range. Paramedics has some responsibility there. The plan itself doesn't necessarily say, here's what's going to happen in year 1, here's what's going to happen in year 2, here's what's going to happen in year 3. If we're just trying to understand how those plans are informing the budget proposal, is there advice on how to best understand that in advance of October, or is it just more an understanding that coming with a list of questions or priority areas for that October budget proposal meeting, just trying to get an understanding of what additional information, if any, might be available to understand what multi-year enhancements are coming forward or may not be coming forward, and just understanding staff's recommendations in that?
Through the chair. So I think one of the challenges that we're still working on in relation to the transition from being Public Health Subcommittee to the Board of Health is looking at those strategies that cover multiple parts of the city in terms of the services that we provide and where best to bring those types of strategy reports. And so that's still being worked out and making, we'll bring forward some recommendations to the manager, whoever it might be the most pertinent group to look at and say, okay, in future going, this should report one way or the other. And so I'm not clear where the community health heat strategy is actually going to land as a specific example. But in terms of, where are we at in undertaking the initiatives in 2025 that related to those areas, that's where you'll see the progress update. It won't be, as I said, complete because of the fact that 2025 won't be complete, but you'll see a progress update as part of that presentation in October.
Thank you, appreciate that. Through the chair, just switching for a second, in the appendices, just a note on program evaluation, really appreciating the KPIs that are shared here. I brought this up in my one-on-one for 26, but I'll say it here as well, as I think there is always a difference between a KPI about program accessibility or availability and a program about program effectiveness. I noticed that particularly in mental health programming, we always talk about, could we connect people to a service? But not necessarily did that service meet outcomes. And so under the low income dental program, there was a really wonderful statistic that said 96% of single parent families felt like their health goals were met. So that's talking about accessibility and the program impact. Through you, Chair, just a plug for me that wherever possible, accessibility information is also important, but just if it can always be tied to an evaluation KPI or making sure there's an evaluation KPI within that as well. And happy if there's a comment there, but just trying to pass that on as ongoing feedback.
Through the chair, no, agreed. We love outcome data wherever we can get it and report it back. This back to the whole challenge that most of public health takes a long time to generate impact data or to sort out what is the other, but completely agree where we've got impact data, we'd love to share it.
Thanks very much. And next on our list is Member Kirkby and then Councillor Tattison.
Thanks so much, and thanks for sharing the performance and accountability report. It really shows, the wide range and complexity of the work being done. My comment was very similar to Alex's. I just was a question around the impact of the work that's being done. So, a lot of the information presented kind of quantified what was happening, the, numbers of seniors accessing dental services or number of children and youth accessing mental health services. So it's just difficult to know what the impact of the work is in terms of, are we seeing improvement year over year? Are we reaching those who face the greatest inequity? How do we compare to other public health units of the province? And are we meeting the targets that we set out through those KPIs? So I think it's similar. You've mostly answered it, Dr. Richardson, but I just wanted to know that through, and acknowledging, that measuring impact is really difficult, especially when we're looking at the population level changes and linking that to, specific interventions. But as we move forward, through the health equity work related to measuring and demonstrating the impact of programs on health inequities, is there a plan to kind of further analyze the data and to report on it in ways that more clearly demonstrates the impact on community or that progress towards reaching the priority goals?
Through the chair, we struggle with this one each year when we bring forward performance reports because of the amount of data we could bring to you. And, trying to streamline it so that it's, it helps the board achieve its sort of strategic level of decision-making and governance and trying to find where that level is. And so I think as we talk more about, how we want to work through things together, those conversations will continue to evolve in terms of the amount of information. Right now, we're also trying to make it quite easily consumed for the public as well, and that's part of the reason this is part of the public report as well. And so I think trying to find that balance, we'll be working on that together as we go to say, like, what's the right level and degree of data and intelligence. I mean, always we want to move from data to intelligence that's going to help us with decision making as opposed to just raw data and that sort of piece. So we'll continue to reflect on it, continue to see, and we need that feedback to say, is this helping? I think what I'm getting from today from yourself is a little more would be good to see. But so, it's something we'll think about as we move forward.
Thanks so much. Yeah, I think it's like that comparison data, or knowing like, what does this number mean? Is it more or less? Are we reaching everyone we need to? Not everyone, those pieces. I do have another question that's just a bit more specific in terms of the actions and outcomes related to the mental health and substance use section. So I'm just curious, that section, I don't seem to see reflected in that kind of the ongoing devastating, impact of the opioid crisis in the city, and the challenges that are associated with that. So coming through the report, like what do we still need to do, or what's, what has been done, what needs to be done, and I'm curious if there is any data. I might know the answer to this, there might not be, but any data to support that the interventions that were named in the report, so particularly the distribution of the harm reduction supplies, have they had any impact on reducing, drug poisonings in the community, or reversing drug poisons in the community, deaths, that type of thing? Thanks.
Okay, thank you through the chair to the member. So very good question, and it is challenging, I think, to sort of quantify that information. So certainly, what we do continue to rely on quite heavily is information from our community partners that helps sort of tell the story of the impact of things like widespread distribution of harm reduction supplies or naloxone. So, from that perspective, it is certainly that, we are hearing that it has a significant impact on reducing sort of harms related to substance use. We also recognize, of course, that we have an ongoing challenge with a very toxic drug supply. And so we're continuing to monitor that situation. We know, for example, what we're hearing from community members and certainly from individuals who use substances, that sometimes it's not just one kit of naloxone, it's multiple kits. And sometimes even that's not overly effective given the toxicity of the supply in the community. So it's a situation that we need to continue to monitor. I think, again, from a data perspective, certainly we can look at opioid deaths. We can certainly look at ER visits. We can look at some of that more concrete data. But we are relying on our community partners to really tell the story of what's happening in the community, what is the impact of things like harm reduction distribution. And certainly the other piece I think it's important is a lot of work on education pieces as well, so that there's an awareness of what's happening in the community around the toxic drug supply.
If I can just add to those pieces, I think, it's important to continue to reflect that we did see a peak in this, and that has come down, and we haven't seen a change yet in that trend. I think the other challenge for us is there, again, many of the things we're addressing there's so many factors that underlie them. For example, with the toxic drug supply, what's the latest drugs, how toxic are they? And so trying to understand the impacts of one particular intervention or the other, it's very difficult to tease that out. And even when we turn to the literature and say, like, has anybody teased this out yet? We're not finding a lot of other places that are really able to do that. And so, we're glad to see the trend having changed, but then, what is each of those specifically resulting in terms of outcomes is a little bit harder to do.
Mm-hmm. Thanks so much. Yeah, just a comment that I think with the urgency of the crisis, sharing out more information on just what has been done and what we think the impact is, or the progress being made is, would be really important. Like what you just shared, Julie, is publicly sharing that would be really great. So, thanks.
Thanks, Member Kirkby. Councillor Chattison.
Coming from my professional background, I'm a little biased towards one of our priorities. It's child and youth healthy growth and development. So much like Councillor Wank's questions about LEAP, does HPH Services support our early on centers directly or indirectly, or is there a relationship? And if so, what's that relationship? Is it one of oversight? Is there duplication in the system? Or is it a synergistic relationship? I know that's a lot, but please unpack it for me.
Through the chair, thank you for your question. Yes, we have a very strong relationship with our early on center partners. So we participate in terms of planning. We want to identify what are the the public health related needs of families that are accessing the centers. Often if there's early on centers with high needs families coming in, then we will work with them to be able to provide some of our services on site as part of their programming. So offering some of our early intervention around children's mental health on site, providing information and education that they can share with families that are coming to access programming is really important. And we really work hard to promote those services to families that we connect with, because we know that for children having the opportunity to engage in play-based learning, to interact with other children, and for parents to have the opportunity to support each other is really important. So we make sure that the families that we're connecting with know about early on centers, they know how to access them. If they need support in actually getting there, our family home visitors will take families there visiting on the bus and show them how to get there and how to access services. So a very long-standing history of collaboration and really strong partnerships for sure.
Thanks. That's a really great answer.
I don't see any further speakers at this time, so thank you very much for all your comments, and thanks for the presentation, Dr. Richardson and everybody else. At this point, we need a mover and seconder to receive the presentation and the report. Moved by Councillor Huang, seconded by Member Kirkby. Any discussion at this point? You've had a chance to ask questions, obviously, but any discussion? Okay, all those in favor to receive by show of hands? Thank you, that's everybody, that carries. So we're on to items for consideration. Number 8, amendments to the outstanding business list. Can I please have a mover and a seconder to approve the amendments to the outstanding business list? I see Councillor Huang, Member Kirkby. Any discussion on the outstanding business list? I see Councillor Nan, and I see Councillor Huang. Councillor Nan.
And unmuted, finally. Okay, thank you. Through you, Chair, appreciate the report. If we could just get some details shared publicly with the rest of the Board of Health members as to why we need a new date on this report back.
Thank you for the question, Councillor Nan. Matt Lawson, Manager, Health Hazards Vector-Borne Disease Program. The effort to try and procure a vendor that could complete both parts of the motion that was approved is proving to be challenging. We have gone through a consultant roster through the procurement bylaw to identify technical abilities of companies. We have met with a few of those companies, and we've identified that there are conflicts of interest potentially between their work with industrial companies, as well as in relation to their ability, and they've recused themselves of being involved and not interested in submitting a bid to do the feasibility report. The second avenue through the roster consultant contract through procurement was done so with the vendors for public engagement who are identified, and there are 2 vendors within that category, and both have been offered to submit a request for quotation of performing the work, and both have confirmed that they are not interested in doing so. There is one more effort ongoing at this time to try to reword or rework the specifications within the opportunity, but it would be issued as a true request for quotation, which would allow us to bring in additional vendors rather than soliciting the willingness or the ability for the 2 identified vendors in the roster category for public engagement to bid. So this could prove to find someone who is interested in doing both engagement and the technical work involved with environmental sampling. And we will know by mid-August if anybody is interested there. But if there is not, we would be back to the square of no company is interested to undertake this work, so what should we do now?
It's very concerning. Thank you for that update. Just in in relation to the community engagement component, appreciating that maybe a more formal RFQ might garner the interest of potential vendors to take on this work. I'm also conscious of the fact that when we were given an estimate on how much this would cost, we rounded it out to about $5,000 per ward. Has there been any assessment on whether or not it's a scenario in which the technicality of the work that's being sought in the feasibility review, as well as the engagement components, both are under-resourced at this point? Is that part of what staff are considering as to why we're failing in getting vendors?
Through the chair to the councillor, I don't have any direct feedback about that from any of the vendors, if that is the reason that they're not interested in taking on the opportunity. I've been speaking with procurement in conjunction with them. We are trying to make it very understood within the specifications, and I believe that it does so, that what's being sought from a vendor is to write a feasibility report, which is essentially a work plan to say, we could undertake engagement, like a pre-sampling meeting, like a kickoff type meeting where we hear from community voices. And then we would, that would help inform actually the technical sampling and collecting, because if there were a vendor identified today, exactly where do we send them to go collect samples? That would be one of the questions of like, where are we sampling for this? Who can show us right now? And I think that engaging the community would help provide some of those leads, if you will. So we would like to when we're going to reissue the RFQ on the latest attempt where we can broaden our search and offer it to additional companies outside of the public engagement category of the roster. We want to be very explicit within the specifications of work that this initial resourcing that you alluded to is related only to drafting a feasibility report. It does not mean that the work will be undertaken. It is a report that shows what the options are. And ideally, I would like to see something in the feasibility report that provides, a minimal resource option all the way up to, on a continuum, if costs were no concern, what would you propose to do to find the answer that the community is seeking?
I appreciate the thoroughness of that response. Through you, Chair, is there a sense of possibility of working with city's engagement team to outline that work that is community engagement so that we don't see delays in this work proceeding? Has that been considered?
Through the chair to the councillor, it definitely could be considered in terms of stopping any current work that we're doing, and we could look to resource engagement of the community, absolutely, if it were the public health staff doing so. I'm not exactly sure
Just to
what that
clarify,
time.
sorry, through you, Chair, I wasn't implying that public health staff would have to do it alone. The city of Hamilton has dedicated community engagement team that's guided by standards of engagement that council has approved.
Through the chair to the councillor, thank you for the clarification. Understood. Yes, our program does engage a lot with the engagement staff, Jocelyn Strutt and her team, and Cindy Much through that group. So by all means, we could look to undertake that engagement. Our first attempts were sought so on the trying to find a all-in-one vendor that would be doing public engagement as well as the sampling, which we had assumed might exist, but we're finding that there is some hesitance on the behalf of vendors to take up this opportunity.
And then final question, and I realized the ding went off because of the thoroughness of our responses, which I totally appreciate. Is there feasibility? So are you suggesting through your chair that we parse out the two deliverables as a go-forward strategy?
Through the chair to the counselor, that is something that is the ultimate decision to you and this group, but absolutely we'd be, if we're directed to begin engagement of the community and to seek out a vendor of the technical side, that's what we would do.
Okay, I might come back on a second time, Chair. Thank you for this response.
Thank you. It's Councillor Hoy next, and Member Kirkby.
Actually, Councillor Nana actually asked a lot of the questions I would have had. Thank you.
Member Kirkby.
She also asked a number that I had, particularly related to the engaging the city's public engagement team, just as a kind of more expedited option around the engagement piece. But one question that I still have, it's kind of a reminder, if you could just clarify again. I believe in the first motion, it did talk about how the Ministry of the Environment has already done testing and follow-up, like around the residue, and taken samples and tested it. Can you remind me did we just never get those results, or do we have access to those results? Do we have information that we're sitting on that we can use to help inform this, like decision-making around this, or do we really need to go back and get these brand new samples to further this work? I just want clarification. I don't remember what the...
Through the chair to Member Kirkby, the Public Health Services has received some information from the Ministry of Environment, Conservation and Parks related to their efforts. They've informed us that they have provided results to those residents who and where they have sampled. We have been informed by them that they've sampled at 67 different locations in between wards 2, 3, and 4. And so we are continuing to look at the data that they have provided us and identify gaps that we perceive and go back to the ministry to request that information to fill in those gaps that are related.
Thanks. So just to clarify, if you get that information back from them, could it be sufficient to not have to go back to an external vendor?
Through the chair to Councillor Member Kirkby, that would be at the discretion of the board.
I guess to clarify again, is the information, like, so you don't know what kind of information is coming that could come back and whether it would be helpful? In terms of, like, are they identifying what the black soot is or not? Or you don't know yet?
Through the chair to Member Kirkby, personally, I can say that some of the results I've seen, we don't have an identified. There are a lot of the results might say typical road dust, but that isn't the full story of what we're looking for here. It's not that we don't believe it's not road dust. I'm not surprised to see that show up, but what we are looking for is something that might be unique to the experience that's being explained by the residents.
Okay, thanks. That's really helpful. And one more follow-up question. With the ministry, is it possible to, is there a barrier to requesting for them to do additional testing at the request of public health services if residents were able to ask for testing independently? Is it possible for public health to get the support from the province or not?
Through the chair to Member Kirkby, if you can just clarify that a little bit. Are you asking if public health can request help from the ministry?
Yeah, can we ask them to test for us in certain locations? It sounds like residents have made independent requests to have their areas, like homes tested or whatever they want tested. Have we made a similar request on behalf of the community versus independent homes asking or individuals asking? Does that clarify?
Thank you for that clarification, Member Kirkby. That is something that, we're also carrying forward that message from to the Ministry of Environment when we speak with them, and we do speak with them on, we have quarterly meetings with them or ad hoc if needed. However, yes, we would carry that request forward, that as much support as you can give us on these files that we're working on with common concern. If we raise a concern about something, the question is always asked, are you able to help do this? And so given that they're a provincial ministry, they weigh out their varying competing priorities as well, and they will try to help. I will say though too, within the last 2 years, again, they've I think they may have collected more than 67, but they've shared the results of 67 samples with us so far.
Thanks.
I have Councillor Nan for a second time. Go ahead, Councillor Nan.
Thank you, through you, Chair. I just wanted to get a sense of, from staff, timeline impact. So initially, when the Public Health Subcommittee reviewed the motion and amended it to include the community engagement component, we were aiming to get the feasibility report back in Q2 of 2025. And so the OBL amendment is proposing a Q4 2025 feasibility report back. What then does that mean in terms of the projected timeline for decision point on implementing the plan and then generating a recommendation report after the feasibility plan is reviewed by the Board of Health?
Through the chair to Councillor Nan, I believe that the Q4 2025 timeline may be within the hope that a vendor is identified through the procurement processes. So if we were to now look at the reporting back with a feasibility report, depending on what, if any, recommendation further or direction comes from the board today regarding the engagement, i.e. if Public Health Services is to set out to do public engagement now, it sounds like there would need to be a report back to explain the plan about how we will go about this, which I think could still be done for 2025 Q4 or Q1 2026. And we would also still need to find, within that consideration, we would still need to find a resource, whether it's the Ministry of Environment, Conservation and Parks, to collect samples and perform the laboratory analysis, or if it's a third-party vendor as per the motion originally.
Yeah, thank you for that. I'm just trying to figure out a path forward that doesn't delay the work too much on behalf of our residents who've been raising the alarm bells on this issue for quite some time. And as staff have acknowledged previously, this remains a health equity issue. And to perhaps some of my board member colleagues, just to clarify, the reason that we haven't asked MECP to participate in this is because, not too dissimilar to the GFL incident, we're at the point where we're asking for a third-party verification of the information, validation of the information, and thoroughness in the part of being able to sample in a triangulated way to those residents who've been most impacted by black soot on their homes, but also perspective of the municipality and our infrastructure as well. So I guess I'm turning to you, Chair. I'm looking for a path forward here that might be reasonable to request of our service in terms of if it makes sense to parse out the community engagement, perhaps what needs to happen is a report back in September about what is the strategy. Should it be public health in doing the community engagement? Should it be the City of Hamilton's engagement team? Or should we be still pursuing a third party to do that community engagement, but give staff a chance to come back in the next reporting cycle with some clarity and some thought to that versus doing it on the floor here today? I'd be very open to that and really want to make sure that this is done as thoroughly as possible and as collaboratively as possible between board members, staff, and the final outcomes that we're trying to achieve for our residents. So I'm turning to you, Chair, for a little bit of procedural advice here.
I'm doing my best to follow along here in terms of the different kinds of options in front of us, considering this is an OBL item. Suggesting mending an OBL item with respect to date is kind of what we can do here procedurally. Going back to amend the original motion is a different activity. So just trying to think that through. Of course, I think one thing we could also do is under the motion section, you could bring something forward just to speak to what you'd like staff to do. that might give you a few minutes to craft that and maybe go back and forth with some of the staff who've spoken about this, just to get a bit of language together. And then under motions, we can have a motion if you'd like to do something further or change the direction previously. As this is now the Board of Health, we're also taking on work from the previous Public Health Standing Committee, if I believe, and so it's a bit awkward. Things we do here are kind of new in a way, but we're trying to be respectful of the work that's already been started. So I'll leave that with you if that makes sense. I'm seeing that you're nodding heads, and I'll look over to staff to see if that makes sense. If anyone objects, no, everyone seems to think that makes sense. So that's how we'll proceed. And we have one further speaker on the list at this time. For a second time, it's Councillor Huang.
Thank you. Just through you, Chair. As you said, Manager Lawson, that you had failed to identify securing a vendor to do both of the work, but did you have a chance to have conversations with vendors on just doing the technical aspect of the work?
Yes, thank you for the question, Councillor Huang. Through the chair to Councillor Huang. Through the procurement roster category, the contract roster, we did speak with 3 vendors that are identified in environmental assessment and remediation that do undertake this type of work. The first company that was engaged was, this sounds a little out of their comfort zone from not quite their lane, they're more of a meat and potatoes soil, taking a soil source and doing an assessment and saying, here's the engineering recommendations about how you remediate this site. The second company went away for over a week, but came back to us with consideration that their senior management was not comfortable given a conflict of interest that they perceive because they do work for steel mills and other companies in the industrial K-zoned areas. And the third company that we connected with was interesting given that they indicated that they would be eligible or willing to undertake the technical work, but we identified through discussion that they also have a conflict of interest with the industrial partners or the industrial entities that exist in the North End, and that they don't do engagement. So ultimately, that vendor still exists as an option for doing, willing to do work, but with the understanding that if they weren't doing the engagement, that might give a little bit more credibility to, okay, they're just being asked to collect samples and do some processing and laboratory identifications.
Okay. Can you help me understand the procurement process? So since that we have a potential vendor that can do the technical aspect, just as Councillor Nan is talking about parsing off the community engagement aspect of this, how quickly could we feasibly get that last vendor to actually do, again, a portion of that work?
Through the chair to the councillor, if we were to go that route, they are already contracted under the roster, the consultant roster contract. So they're already really ready to go. Again, the issue would be, without performing engagement in the community, where would we send them today? If there was somebody saying, I can go collect samples right now, where do we send them to go collect a sample of soot in the North End?
Again, I think my question then comes back to, we have information and data from 2, 3, and 4 already. And again, I'm trying to understand the procurement process, because if we're talking about sending them, couldn't we just feasibly tell them 2, 3, and 4, wards 2, 3, and 4? And then the community engagement aspect would be something completely separate. So I'm just I'm struggling to understand the parameters around this, because I would think that it's very clear that we're sending them to wards 2, 3, and 4 to do this work. So help me understand that, please. They're just chatting.
Through the chair to the councillor, there would need to be a sampling methodology about where we would be sending them? Like what would the vendor be saying to us about how they can help identify where black soot is in the city? So there would be a need to identify where exactly are we going to sample this? And it was just a belief that the engagement part of that motion would have helped inform some of that if we were hearing from people specifically. But there's the issue of, okay, what would the sampling methodology be for such an issue? And we'd want to hear that from the vendor. That's something that they would come back with proposing.
So again, I'm struggling to understand because the intention of this motion is the feasibility of a potential sampling, which in my opinion, as a technical vendor, wouldn't they help us with identifying what the feasibility is? So like, I feel like that's part of the work if we're actually doing that. So I'm just help me understand, please.
If I could, through the chair, I think that's what, I think in what you're hearing from the manager, from Matt, is that they still have those linked in terms of those things, but you're quite right, that in terms, we would still bring back, ask them for a feasibility report about doing that data collection, the sample collection and the sampling methodology, and the, as well as the technical aspects of what they could test for. So yes, that would still come back as part of that report, and that would have to be sorted out. In terms of how they would do it, assuming that then the engagement somehow is disconnected from that process. So they would have to do that without an engagement process.
And I think that that's kind of where Councillor Nan is going, is that if the holdup is the fact that that engagement is separate and if it were separate and distinct, could the work, at least half of the work, still proceed moving forward, and then have the community engagement aspect be a wholly separate report, and then together the Board of Health can look at both of these reports together for next steps moving forward anyway? Is that a potential way forward?
If I could, through the chair, I think the challenge will be what's the engagement about? And so I think what you would want us to do is, if the desire is to have the technical data back sooner rather than later, that could be done through this feasibility report, move it forward. And then the question will be, what's the engagement piece about in terms of understanding the story and that sort of thing? So I think we'd need to work with, if the desire is to get the sampling done, we can move that forward. And then I think we'd need to explore a little further how the engagement fits, what the engagement's truly about.
Okay, I will take this offline. Thank you.
Thanks, and seeing as Councillor Huang was the last speaker, I'm just going to add myself to the list and pass the chair to Councillor Huang really quickly. Trying my best to follow all the multiple bouncing balls in different directions on this subject, the longest ever discussion on an outstanding business list item that I can think of, but a good one all the same. I just want to add a couple of thoughts here. Walk down Burlington Street in Ward 2, your answer is solved. Like, I think some of this just requires a survey, right? So someone to just go out and survey where that we're seeing black soot in spaces. Of course, we need to have input from the community around where they're seeing impacts, right? I remember before I was an elected official, I went out with Environment Hamilton and we used air particulate matters, those readers, pardon me, to go out and assess where we saw concentrations of strong particulate matter. I don't know if that's really the applicable model for soot, but I'm just suggesting that the part of this looks like it needs to be survey work done. I think also you can consult with some of the councillors and the first line of engagement as well, as in terms of where we see those spaces and places, right? Like I know when I knock on doors along Burlington Street or I engage with people there, I can visibly see the big difference between Burlington Street and, for instance, Picton or Ferry or Simcoe, right? I can just see it. So I think that's part of where we're kind of confused a little bit, is that we know where this is already occurring. I think some of it's a visual inspection, a survey. Maybe that's just part of the work here, right? Survey, analysis, and I think that's all part of the feasibility. So I'll leave it to Councillor Nan for whatever wording she's going to come up with, but I thought I would just add that in there. Like, I think this is all, I think we're getting too technically involved in this maybe in a certain kind of way. There's some part of this is just look and see. I'll take the chair back and we'll go to our first electronic vote. So I say that because this committee hasn't had electronic votes before. We're all on the electronic system, and we're going to vote to receive the items in the LBL. I believe we don't yet have a mover and seconder, so I'll ask for that right now. Moved by Councillor Tatis. Oh, we do already, pardon me. I got the ayes. The ayes tell me that we have one. And so we'll go to electronic vote at this time. And the vote is up. And you'll just indicate yes or no. You can't abstain unless you have a conflict.
I'll just need either a thumbs up from Member Chung or thumbs down. Thank you. And Member Johnson, are you still with us? I'll just need your vote as well. Thank you.
And that carries 10-0. Congrats, everybody, on your first electronic vote. And we're now going to move on to 9 even, motions. And 9.1, the beach water quality testing and advisory protocols at Binbrook Conservation Area is the first one. Just want to highlight for everybody, we have a couple potential motions coming forward, one with respect to heat mitigation efforts and one with respect to something Councillor Nan is working on with the soot. So just flagging that as to keep in your mind. Otherwise, Councillor Taddison, and please don't read your motion, but please just introduce your motion and speak to it broadly, if you don't mind. We all have it, and we've had it for some time, so you don't need to read it into the record. But by all means, if you'd like to speak to it, please do, and let us know who your seconder will be.
I was hoping I could read it to give people time to complete their other work as they're going through today. However, it's moved by myself. It's seconded by Councillor Wing. I'll read the therefores, and then I'll come back and speak about it. So, therefore be it resolved that public health services be directed to engage in formal discussions with the Niagara Peninsula Conservation Authority to explore the feasibility, legal authority, and operational requirements for transitioning beach water quality testing and public swimming advisories at Binbrook Conservation Area Beach from Hamilton Public Health Services to the NPCA staff. That the staff report back to the Board of Health with findings and recommendations no later than Q3 of 2025. That the report consider relevant legal opinions, service delivery models, operational impacts, communication strategies, public safety considerations, and opportunities for interagency collaboration. And that the City Clerk forward a copy of this resolution to the NPCA Board of Directors for information. Now, speaking generally, at the risk of repeating myself, again, this is about our public health staff engaging in formal discussions with the NPCA for transitioning beach water testing from HPS to NPCA at the Binbrook Conservation Area. The motion is asking for a report back to our board with their findings and recommendations. I've read several reports on beach water testing in Ontario. I've had several separate meetings with both NPCA and HPH staff, and I truly feel that dialogue between the NPCA and the HPH on this matter is warranted. The HPH and NPCA currently use different methods for reporting that make things less clear for users and NPCA staff at the beach in Binbrook. The NPCA is willing to take on the responsibility for the beach water testing and reporting in the Binbrook Conservation Area, so it is consistent across their watershed for their membership and park users. The NPCA reporting methods have a demonstrated safe track record as they've been used at beaches at Chippewa Creek and Long Beach for several seasons. The NPCA has the resources that can be directed to the beach water testing in Binbrook at a time when our own Hamilton Public Health Services report says that we have a widening gap between available resources and service demands, increased demand for public health services, and a continued need for increased workforce flexibility, and heightened expectations to demonstrate the impact and responsible use of public funds. So, the NPCA has the resources that can be directed to the beach water testing in Binbrook. Allowing the NPCA to take on this would free up Hamilton Public Health resources. It would be at no cost to the city. It's a potential win-win-win, a win for Hamilton, the NPCA, and our residents that use the conservation area. But at this point, this motion is only asking Hamilton Public Health and city staff to engage in authentic, data-based decisions with the NPCA and bring a report back to us with the findings. And I thank you all for your consideration.
Thanks very much. Is there any speakers on this motion before we go to a vote on it? Nope, not seeing any. Okay, we're going to go, oh, pardon me. Oh, Dr. Richardson, you want to say something? Go ahead.
Sorry, I know the chair, that was directed to members of the board, but just one comment. I think it says to report back in Q3 2025, which would be on September the 8th. I don't believe that's feasible for staff to report back by that date. So perhaps Q4 of 2025?
Friendly amendment accepted from staff.
Thanks very much, and thanks for that clarification. Appreciate it very much. So that's a friendly amendment. On that, not seeing further speakers, we'll go to the electronic vote. Those of you who are online don't have access to the electronic system, you can give the virtual thumbs up and we'll record that. And the vote is up. That carries 10-0. Thank you very much. Now I'm going to pause briefly and say that we have some language that the clerk has prepared in advance if anyone wanted to bring forward a motion with respect to asking either that the Board of Health have a report come back here, which again, I said the timing might be a problem for that, but you're welcome to do it regardless, or the option of having the Board of Health staff participate in the ongoing motion that's happening at GIC with respect to heat mitigation. So I'm only mentioning, up to you which one you're interested in doing. I'm only mentioning that the first one's going to be probably a timing issue for us. The other one is a more collaborative thing. We'll have recommendations from Board of Health and recommendations from HSR staff in the same report. And then people can delegate to GIC there and talk about it there. So I'm just going to pause. Anyone can just say what they want to do. And we already have the language, so we're good.
I think I prefer the collaborative approach.
Okay, so you want to move it?
Yeah, sure.
Doing it there, seconded by Member Jacob. Okay, so I'm just going to say it again. So what we're going to be moving and seconding here, moved by Member Kirkby, seconded by Member Jacob, is that we're going to have public health staff work with those, whoever those are, of city staff on the report that's coming forth to GIC on this issue. Everyone seems to think that makes sense. I'm not getting any panicked eyebrows. And we'll go to speakers. Councillor Alex Wilson.
Thanks, and it's okay if the answer is not in this room. Is the report back that's already happening by PW staff scope to just this item, kind of 10 of the community heat response, this fair piece, and so that's what's going to come back as scope to here, or is it a broader report back on the heat response strategy, and then this will be, 1/10 of the report, we'll still have this, we're just trying to get a understanding of what that forthcoming deliverable is and how scoped it is. Doesn't impact my vote on this, just trying to understand what we're going to get back.
Okay, does anybody have any more insight here? Dr. Richardson, perhaps?
I'm looking at, in part at Matt Gauthier. I believe that it's related, the motion that was made back in April was scoped specifically to free transit in relation to heat days. It certainly, as I recall, it wasn't about the broader heat response strategy.
No, thank you. I appreciate that. I'll do some offline follow-up. I think it's helpful for us as a group and for folks who care about the heat strategy to understand when that report back is coming up as a more holistic deliverable to discuss what's going on citywide. But just, yes, supportive of the motion in front of us for this piece of the consideration.
I also want to draw your attention to, before we vote, that on the agenda for today, and thanks very much to Miriam for sending this in, item 6.2 AA, or A, pardon me, but there's another A there, actually has the proposal in it, right? So we have the context for that, and we know what's being spoken to specifically, so that public health staff have that there. We didn't have it before, so you have that now, and it's helpful, even though it may have formed the previous part of the motion that came forward to GIC, just letting you know that it's also there.
Sorry, Chair, I think I lost track of what you were referring to.
So there's correspondence from Hamilton 350 with the actual proposal in it.
Right.
On the agenda. And so we didn't address that or speak to it, but it's there, and it's important because when this first came forward, it wasn't there. And so it was on the heat proposal, and the details are there so public health staff can see what's specifically being proposed. On that, we'll go to the electronic vote. Oh, no, we won't? Okay, Councillor Wang, pardon me, go ahead.
Chair, just procedurally, because this is a motion that's going to collaboratively work with HSR staff, that the report will come to GIC, how does Board of Health get that information?
We probably won't get it back to us directly. So what we could do is, that's what we're doing here. We're choosing a different route. We're choosing, rather than having a report come back here, which probably wouldn't come in time because of the work being done elsewhere,
Right.
that we're actually choosing for it to happen in a bit of a different route. It means the city will get the report back and we'll be able to participate in GIC. However, if when the report comes out, people would like it to come back here, that's an easy activity to make a motion about, right? So if there's some reason why we feel like it still needs to come back here, at the time when the report comes out, we could do so.
So just so I can understand procedurally, once this is gone to GIC and it goes to the city, and then Board of Health members will just have to be watching the city sort of correspondence in order for them to understand how we would close the loop on something like this then.
Even more directly, Councillor Huang, that's the reason there's 6 members of City Council on this Board of Health, right? So
Agreed.
it's our responsibility to steward those kinds of things, and we will do that. And if there's a reason why, for instance, delegates should come forward and say, look, the timing is weird, we'd really like the Board of Health to still endorse this now that it's out, and then go back to GIC because there's some kind of gap and we can do that, they may ask to do that, and we may move that we do that. But we just don't know yet because we haven't gotten the information. So there's kind of many paths forward in the future. I think we just have to wait to see when the report comes out if that really answers all the questions people are asking.
I see. Okay, thank you.
No problem. Okay, I don't see anybody else in the vote, so now we will go to the electronic vote. And it's up.
Thank you.
And that carries 10-0. And now I'm going to turn it over to Councillor Nan.
Thank you, Chair. I think Elsie Gauthier has been working in the background at a feverish pace with myself and Dr. Richardson in finalizing the language for direction to move forward on the Soot work.
Through the chair, I'm still working on the language, so if the board is comfortable, we could go in principle that staff would be reporting back on the feasibility of separating out those two components. Otherwise, I would just need a few minutes just to finalize it. So I'll leave it with the board. And
I'll just look around here to make sure if anyone feels like they want to see it exactly written out. I'm not seeing anyone indicating fussily. I'll come to Dr. Richardson in a moment in case she wants to add anything. Dr. Richardson.
Can I just suggest, I think timeliness is part of the issue that we want to underscore here. So I was just going to suggest that the motion, rather than come back with feasibility on both, that it be separation of the technical aspects and the technical aspects move forward, and then come back with feasibility around the engagement.
Just going to look at Councillor Nan.
Yeah, thank you, Chair, and thank you, Dr. Richardson. Yes, absolutely. Don't want to delay the technical work. Let's get that going ASAP in the interest of our community, and secondarily, give us some options in a report back. I think you had said in October versus September for Board of Health in terms of a go-forward strategy for clarifying both the scope and the principles for the community engagement components.
Everyone is nodding their head. I'm just affirming that that's the
Great.
case. And everyone here seems to understand what we're about to do. So we are going to go to electronic vote, and the seconder is Councillor Huang. Member Chung is in favor, and the vote is up. And that carries 10-0. We have no notices of motion. We do have an item in which to go into a closed session about, but before we do that, I'm going to make a small announcement about the hate incident that occurred earlier today, just so while everyone's still in the room, because I know once what happens, you go to a closed session, people leave, they don't necessarily come back. So I'm going to take that chair's prerogative. The corporate security team at City Hall is investigating the hate incident that occurred earlier today in council chambers. Corporate security has asked anyone who feels comfortable to come forward to speak directly with those leading the investigation, including everybody who's in the room today. If you need contact information to reach the folks in corporate security, you can obtain it from the Secretary of the Board of Health by emailing him directly if you're a member of city staff, member of the board, or if you're a delegate, or by just emailing clerk@hamilton.ca. The board secretary will also reach out by email to everyone who is here, all the delegates who attended, to ensure they're aware of what the procedure is if they want to be involved in the investigation and report what happened or any impacts. Anyone who doesn't feel comfortable sharing this information with our corporate security team for any reason can submit an online report of this incident through the Hamilton Anti-Racism Resource Center at harc.ca. If you need this link, it's harrc.ca. You can also email the secretary or clerk at hamilton.ca and you'll be provided with a link. So just want to make sure everyone's aware that we're taking this very seriously and we'll be investigating it. For my purposes, I didn't really hear 100% of what the person was saying, so everyone may have a different recollection. And so I'll also let you know that it appears that CHCH caught it when they were filming and that the audio was audible during the live stream. So there's information out there, but we're going to continue to investigate and then we'll report back to the public what we found. On that, we're going to go into private and confidential. So we need a motion to move into a closed session. Can I have a mover and seconder to do so, and then I'll read out the legal terms. Member Danko, seconded by Councillor Alex Wilson. That the Board of Health move into closed session for item 11.1, BOH 25019, respecting the appointment of an associate medical officer of health pursuant to section 8.3, subsections B and D of the board's procedural bylaw BOH 25001 and section 239.2, subsections B and D of the Ontario Municipal Act 2001 as amended, as the subject matter pertains to personal matters about an identifiable individual, including city or local board employees, and labor relations or employee negotiations. This will require an electronic vote. And that vote is up. Councillor Huang is in favor. Member Chung is in favor.
Member Johnson, just waiting for your vote.
Member Johnson's in favor.
Oh, thank you.
And that carries 10-0. Members of the public are advised that during the closed session portion of the meeting, the live stream will broadcast the closed session in progress screen. The broadcast will resume when the closed session portion of the meeting is complete. The board will wait up to 5 minutes upon reconvening an open session before proceeding with the meeting to provide members of the public and the media time to return. As we're now moving into closed session, I'd ask all members of the public, delegates, and external participants to now exit the chambers and the WebEx meeting. Additionally, any staff that are not directly related to the in-camera item are now also asked to please exit the meeting. We'll take a couple of minutes to go into our closed session, and we'll see you back afterward, everyone. Welcome back to the Board of Health meeting for July 28th, 2025. Still chair of this committee, or to Councillor Cameron Kretsch. And we're back now in open session with respect to item 11.1, Board of Health 25019, the appointment of an Associate Medical Officer of Health. I need a mover and a seconder to approve the open section recommendations, which I'll briefly read. That the direction provided to staff in closed session respecting Board of Health Report 25019, appointment of an Associate Medical Officer of Health be approved, and that Report BOH 25019 respecting the appointment of an Associate Medical Officer of Health remain confidential. I'll take a mover and seconder, then I have an amendment. Moved by Member Kirkby, seconded by Member Jacob. I have an amendment I want to add, so if you wouldn't mind taking the chair, Councillor Huang.
Sure, please go ahead.
Just want to add a C that says that the Board of Health recommend the City of Hamilton develop a written policy for the selection of medical officers of health and associate medical officers of health.
Okay, and who is your seconder?
Member Jacob.
Excellent. Are there any questions, comments, or concerns on this particular amendment? Seeing none, I think we do need an electronic vote on this one, so. Vote is up. I think Dr. Chung is a yes. And that vote carries 10-0. Chair is back to you.
Thanks. So on the motion as amended, all those in favor, and the vote will be up soon. We've already have a mover and seconder. All those in favor of opposed, and the motion is up.
Member Chung and Member Joseph, could you just indicate again? Member Johnson? Thank you.
And that carries 10-0. We have two more activities, bylaws. So just someone to confirm that everything we did today is real and can happen. Councillor Huang, Councillor Tattison, any discussion on today's bill to confirm the proceedings of our meeting? Not seeing any. We will require electronic vote for this, which is up now. Member Chung is in favor. And that carries 10-0. And now we're adjourning as there's no further business at the Board of Health today. Today's meeting adjourns at 12:11 p.m. Thanks very much, everyone. Be safe out there. Have a good day.